Can't join us. So again, welcome to this really important conversation. If you didn't know, March is Colorectal Cancer Awareness Month. And it is really important for us to know what to look for and how to prevent this cancer. And we're really lucky to be joined tonight by MedStar. Lynn McFadden is here, and she works with MedStar's Colorectal Cancer Prevention in the Neighborhood program. So Lynn, could you please take it from here?
Okay, thank you so much, Nadia. Good evening to everybody. We welcome you and thank you for taking the time out this evening to spend with us. My name is Lynnell McFadden. Excuse me. I am a community navigator at MedStar Washington Hospital Center for the Colorectal Cancer Prevention in the Neighborhood program. I am also a Brooklyn resident. Yeah. That was a shameless plug to throw in. But with the work that we do is important, very important. And I always let folks know that screening is important because screening is what saved my life. 10 years ago, I was diagnosed with breast cancer and it was caught early. So I'm an advocate for screening. I'm an advocate for awareness. I worked 40 years for the government and retired and was pulled into breast cancer awareness out of retirement because I believe that I have a story to tell and I want folks to be aware of their bodies and to know that screening and awareness is important. So I'm really glad that you all have joined us tonight. I have some of my faves from MedStar on the line here tonight. And I'll let Marjorie start and then we'll go. I'm not sure if anybody else, Marjorie's here from MedStar. We work together at MedStar. Marjorie works in a different department, but we work hand in hand. We may be, under two different budget codes, but we're doing the same thing. We're talking about awareness. We're trying to help folks understand the importance of the screening. So thank you all again for joining us tonight. I think that you will enjoy this presentation. It'll be a lot of information shared. At the end of the presentation, if anybody is interested in one of the screening kits or interested in getting a colonoscopy, we can help you with that as well. So we're a one-stop shop here. So thank you all so much. And I'm going to turn it over to my counterpart, Marjorie, who we worked together for a while, and I enjoy working with her. Marjorie?
Thank you, Lynette. Good evening, everybody, and thanks for attending this evening. My name is Mark Block. I am one of the lead nurse navigators on the MedStar Colorectal Cancer Screening Program. As Lynnell mentioned, we are a grant-funded program through the Carlin and Lawrence Silverman Family Foundation. And our overall goal is to reduce barriers to colorectal cancer screening, diagnosis, and treatment through patient navigation. So helping patients in the community overcome any barriers to completing screening. Our physician lead on the program is Dr. Sarah Berkey, who will be doing a lovely presentation tonight on colorectal cancer screening and prevention. So without further ado, I will introduce Dr. Sarah Berkey, and who will take over from here.
Thanks, Marjorie. Thanks to everybody for this opportunity to talk today and talk about colon cancer. I'm a colorectal surgeon at MedStar, primarily at Washington Hospital Center. And so colon cancer and screening is very dear to my heart, and preventing, either diagnosing early or actually in preventing colon cancer is something that's really important to both myself and my partners and our whole group. So I'm just going to talk a little bit about what colon cancer is and the screening methods that we use. So I'm just going to share my screen now. Let's see. Can you guys see my screen okay? Okay. So we're going to talk about colon cancer screening in our program particularly. So colorectal cancer, it starts in the colon or the large bowel. The GI tract contains is your mouth the whole way to your anus, and the colon cancer is in the large intestine or the colon, which is seen here. And this is the stomach, this is the large intestine, and then this is the anal canal. Who is at risk for colon cancer? Those are people over the age of 45. The incidence in colorectal cancer has gone down. We're seeing it in younger and younger people. So in 2018, they recommended changing the screening rate from from 50 to 45. People who have a family history of colon cancer, people are poor diet, meaning too much red meats or processed meat, such as hot dogs or lunch meat, lack of physical activity leading to being overweight or obesity, smoking and tobacco use, and heavy drinking. Colon cancer starts with a polyp. This is the unique thing about colon cancer screening, is identifying these polyps. These are precancerous lesions. About 10 to 20% of the polyps become cancer. And polyps usually bleed or tiny amounts of blood. So a polyp is, this is the colon wall. A polyp is a tiny lesion or mass that's only involving the first lining of the colon wall. And what happens is as the time goes on, there's mutations within the polyp that lead it to become it starts to become cancer, and then it goes to a more localized cancer, bigger tumor, and it can become through the colon wall and spread distally or spread to other parts of the body, such as the lymph nodes, the liver, or the lungs, and that's stage 4 cancer, which is much harder to treat. So how do we screen for colon cancer? There are 3 main screening tests that we use. And we really try to individualize it to the patient. For us, it's what screening method is going to be used by the patient. What's the patient going to complete? And the gold standard and the test that was used widely for many years and is still used. We use it all the time because it still is the gold standard. Is a colonoscopy. This is where the long, thin, flexible tube that has a camera on it visualizes the colon wall, and it allows us to look for these growths and remove them if we find them. And that's like I said, the beauty about doing colon cancer screening is it not only finds early cancers, but it removes the polyps like seen here in the right upper portion of the screen. And the nice thing is, if it's normal, you repeat it in 10 years. You need your next screening test in 10 years if the colonoscopy is normal. However, it does require the patients to prep. So that means you have to drink this mixture that cleans out the colon so we can see the colon wall well. Also, patients have to undergo anesthesia, so they have to usually take the day off of work and they have to find a ride home, which we have encountered can lead to barriers of actually completing screening. So 2 of the newer tests are a FIT, which is a fecal immunochemical test, and a Cologuard. These are both at-home screening stool tests. And the FIT requires just a smear of stool, and it looks for blood in the stool. And if it's negative, you can repeat it every year. A Cologuard is new. It's new within the past, I think, 5 to 8 years. And this is where you get a kit there. The Cologuard company sends you the patient the kit, and they actually supply a pretty large stool sample. And they send the stool sample back, and they look for both DNA and blood. The nice thing about it is if this is negative, you repeat it every 3 years. If either one of these are positive, then you need a colonoscopy, because that means that there's a polyp, there's a bleeding. And so you undergo a colonoscopy to identify and treat those polyps or cancer. Interestingly, Cologuard is not always covered by every insurance, but recently within the past year and a half, Medicare and Medicaid have both are covering Cologuard. So this is becoming a very good option for us, particularly for our patients who are busy, who don't have rides, we find it very difficult to get them through to complete a colonoscopy. A Cologuard is a really, really great option because most insurances actually now do pay for it, and specifically Medicaid and Medicare. Oh, this is okay. See. And the big thing is the earlier that the colorectal cancer is found, the greater chance of survival. Here again, we talk about the size of the tumor. The earlier it's found, the better the outcomes are. You can see here, there's just like any cancer, it's stage 1 through 4. It has to do with if it's just in the lining of the colon wall. 2 is a little bit deeper down. 3 if it's in the fatty tissue surrounding the colon. 4 if it's spread to everywhere else. So you can see here that if it's found early, particularly stage 1 and stage 2, patients have a really good survival rate at 5 years. And at stage 1, patients, they're 92% survival rate at 5 years, which is really, really great. And that's why we encourage the screening, is so we can really find these early and prevent them. This is just what a normal colon looks like. Just, you can see a nice good prep here. This is the pinkish tinge. And then this is what a colon cancer looks like on a colonoscopy. You can see the angry red appearing lesion right here. So what are some signs and symptoms of colon cancer? And just like a lot of GI cancers, you don't know until it's a little bit later on, because there aren't any hard and fact like specific signs. When you start to see rectal bleeding or blood in the stool, changes in bowel habits, constipation, thin, narrow stools, bloating, abdominal pain that doesn't go away, unexplained, unintentional weight loss, it's often that the tumor is bigger and the cancer is bigger and it may have spread elsewhere. It's also really interesting that some patients do not have any symptoms at all. And so it's important for all people to be of ages 45 to 75 to be screened. We have patients who are diagnosed with anemia on routine blood tests, meaning their blood counts are low on blood tests. And that's how they get sent for the workup, and that's how they find the cancer. So they didn't even know. So some people, they really don't have any symptoms. So how can I prevent colon cancer? Big things are eating healthy, increasing fruits and vegetables, living an active lifestyle, avoiding excessive amounts of red or processed meats, quitting smoking, and then drinking alcohol in moderation. Big thing is we have like Marjorie said, is we have a great screening program that we really helps utilize all the resources at MedStar as well in the community to overcome barriers to help increase screening rates with patients. We have two nurse navigators, Marjorie and Erica. We just hired a new patient navigator, Jemiah, and I think she's on the line. So we're really excited about her. And that actually comes through the Department of Health at DC Department of Health. And so the Department of Health has been really instrumental too in helping us grow our program. And we have, so not only navigators, but we have resources available such as Uber health rides and chaperone services to help patients who don't have rides, don't have someone to come home with them, to really help overcome these barriers. We also use a text messaging system and can help subsidize prep. There's we have a variety of means to help patients overcome these boundaries or barriers. And these are this is our number or our email if anybody is interested or has any questions. So really, I really thank you guys for taking the time to talk today, and I'm happy to answer any questions, both Marjorie and I think, like I said, I think Jemiah is on the phone too, call too.
Thank you so much for that, Dr. Berkey. Yeah, we welcome all of your questions, so please ask away. I know the first one that came to my mind is sometimes I have very narrow stool, so like small and skinny. So like how, like, should I be concerned if it happens once, if it happens for a month straight, or like what, how alarmed should I be?
Yeah, that's a really good question. It's something that happens consistently over a period of time. Or you see if it happens one time, it's usually something that's not anything to concern or be concerned about. It's if it is a gradual change that is prolonged over a course of time, and usually comes in additional with abdominal bloating, abdominal pain, maybe starting to see blood in your stool.
Thank you. Any other questions?
This is Pat Tony with a question. Can you hear me?
Yes, thank you, Pat. Please state
Thank
your
you.
question.
Okay, the question is, in preparing for a colonoscopy and being on a proper diet, is it a high fiber or low fiber diet in terms of getting your system ready for colonoscopy?
That is a really great question. The only time I tell people to be on a low fiber diet is 3 days before their colonoscopy. We encourage people 3 days before their colonoscopy to help with the prep. It just makes it a little bit more gentle on their system if they're on a lower fiber diet.
Oh, thank you.
Of course.
Just to piggyback on that, we usually instruct, Dr. Berkey has her patients and all of our providers follow low fiber. So no fruits, raw fruits and veggies 3 days leading up to the procedure, avoiding any whole grains, which sometimes when we're trying to navigate patients, they look at us like we're crazy, like, wait, no one's ever told me not to eat fruits and veggies or not to eat whole grains.
Oatmeal.
Yeah, exactly. But as Dr. Berkey mentioned, fiber tends to stick to the colon, which then makes it a little harder when you're prepping. So as long as you follow that low fiber diet, and then the day before doing a clear liquid diet, patients usually have really good prep and a clear colon.
Thank you.
This is Naomi Seeley. I would like to know what blood in the stool looks like.
Yeah, that's a really good question. It can vary, actually. You can see blood on the outside of the stool, so it's like lining, streaks of it. You can see blood in the toilet bowl, or you could see kind of a dark tarry stool as well. It's more black. It all depends on where it's located in the colon and where the blood is being lost from. So if it's closer to the small intestine, it might be darker and tarrier. You have darker, tarrier stools, but if it's closer to the rectum, it'll be more bright colored. So it'll be a brighter red, streaking the stool, and then cut maybe blood in the toilet bowl too.
Thank you.
Yeah, of course.
Okay, I have two questions. Okay, the first one that I got was, how effective is the Cologuard test? And then the second question is, are you awake for the procedure?
Good question. For the colonoscopy, you're not awake at all. That is actually the easy part of the whole colonoscopy, is actually the procedure itself. You come to the hospital or the surgery center, you meet the anesthesiology team, and they put you to sleep. And so then the procedure happens and you wake up in the recovery unit. You don't even remember that the procedure happened. And then the proceduralist will come out and talk to you and let you know what they found. They'll give you a copy of their report. So the good thing is you're not awake for that. And then the Cologuard is actually very effective. There are false negatives, meaning you have something that doesn't pick up, but the bigger the polyp, the more likely it is to be positive. And more often than not, we see more false positives, meaning will go to do a colonoscopy or go to do a colonoscopy after a positive Cologuard and there'll be nothing there, then false negatives. So it's errors on the being overcautious than missing things.
Great. And then the next question is, how about the other test kit? How effective is that? The immunochemical, I think you called it the FIT test. And then the next question is stool always visible or even normally visible with polyps? Sorry, is blood in the stool always visible or even normally visible with polyps?
Two really good questions. So the FIT is like 50. I mean, if it's positive, that's good, but if it's negative, it can miss things. That's why it's recommended that you do it every year, because it's not as sensitive as the other two tests. But it's a really good, it's pretty inexpensive to do. We can give it out. We have subsidies, so we can give it out for free. So it's a really good screening test for people who don't have the means to do other ways. And for polyps, blood is rarely actually seen in the stool. Sometimes if it's really close to the rectum, the bottom part of your GI tract, but if you're seeing blood, it could be more of a sign of, we see it more frequent with cancer, when it's progressed to cancer, as opposed to polyps, when the polyps are secreting blood that's not visible to the naked eye.
Okay, so just to clarify that, polyps, you don't typically see blood in your stool.
That's
unless
correct. You
it's
have to,
close to the rectum.
yes.
Okay.
Meaning closer to that's where the stool comes out, is the rectum. And so if it's closer, sometimes there could be a little bit of blood that you would see because it's closer to the rectum. But polyps, typically you don't see the amount of blood it's not a large amount of blood. So it's not visible by the naked eye for polyps.
Okay. Thank you. How do you submit your test? Like, how does that process work? Like, do you get it in the mail and then do you mail it back, or do you have to bring it in? Or I guess the nurse navigator would help with that, but
Marjorie would help with that. But you do actually, like, the Cologuard actually is a really good, right now has a really good system, and they actually send the kit to you. And you take it to, I don't know if I think it's USPS or UPS. I don't know, Marjorie, which one is it?
Yeah, it's UPS.
Yeah, UPS. You take the kit back to UPS and they'll send it back to the company.
And with the FIT test, you just mail it. We give you the test and you do your sample and you just drop it in the blue box and mail it back. USPS.
The
Great.
sorry.
Go ahead,
Yeah.
Marjorie.
The company that makes Cologuard, Exact Science, they really make it easy for patients too. So they will even schedule a UPS pickup from your house, and you can do it right on their website. So for patients who opt for Cologuard, or the average risk patients that opt for Cologuard, they try to make it as easily and user-friendly, if you will, as possible.
So it's a really great option for people who it's hard for them to take off time to get the actual colonoscopy. It's a really good option for that.
Is there like a time limit once you do the test to get it back?
Yeah, usually they want you to ship it back pretty quickly. So the max, I believe, is like 4 days. So if you're planning on taking it, what I usually recommend to patients is call the 844 number. They're there to help, or go to the website and schedule your UPS pickup the day before you take the sample, which is easier for people who are a little more regular, right? So if you have a history of constipation, it gets a little trickier, but that's okay. Even if you take it same day, you can call or schedule the pickup online. They can come the next day. But usually you want to take it and ship it off as quickly as possible. Usually the results come back within 2 to 3 weeks.
Great. And then I have 2 more questions here. This is about finding a GI doctor in the DMV area. Someone asked, sometimes it can take months before they can get an appointment. So if you have any tips there.
I do usually, or I don't know if that was Dr. Berkey going to talk, but
No,
usually
you can comment on this.
so unfortunately, that is the case. We have, I know at MedStar and a lot of other healthcare systems within the city or DC, it's been challenging. So pre-COVID, no one was getting screened. Post-COVID, now everybody's coming back to get screened, and it's causing longer wait times. On average, we can usually get someone in within 4 to 6 weeks if you're presenting, and that's someone who has no symptoms at all. But if you are having any blood in your stool, nausea, vomiting, any signs or symptoms, it's important to say that to wherever you might be scheduling, whether it be at MedStar or outside MedStar, and usually they can see you sooner.
Do you have to get a referral first, like from your internal medicine doctor?
Typically, it's your primary care that's referring you to a GI doctor. So if you're going in for your annual physical and you're 45, they'll likely talk to you about the importance of screening at that appointment. Or if they see that you've never been screened, your primary care is typically the doctor to make that referral for you. With that being said, if they haven't, we always tell patients, to advocate for themselves and make sure that they're aware of the screenings that they need to get done at the specific ages, right? It can get confusing. So knowing that if you're 45, that it's important that you go ahead and talk to your primary care doctor about getting screened.
And for the people on this call who would like to go through the neighborhood program that you're offering, they would just call the number or call the 202-839-1822 number. And if you're 45, you're eligible, 45 or over.
For the kit, Nadia, I want to give you a different number. For the CCPN program, they can call my office and I'll call them back to get their address and mail the kit to them. If they need a colonoscopy, then we can refer them to Marjorie. But this is a part of CCPN, this event tonight, so we want to go through that program.
Okay, so the number on the slide wasn't the program.
No.
I apologize for that. Yeah.
That's okay, Dr. Berkey. They can call 202-877-5929 and leave a message, and I'll just leave their name and number, and I'll call them back to get their information. And then again, too, if they want to get a colonoscopy, they can leave that and I'll refer that to Marjorie.
The number on the slide is my direct line. So usually we hand that out to patients who are interested in scheduling their colonoscopy consults. But so yeah, either way, but at least if you do end up calling the number on the slide, if that's shared, just let me know or whoever answers that you attended this presentation today, and we can definitely help you regardless.
Okay. So what if you're under 40 and I don't know if you have some symptoms or signs or not? I mean, if you're under 40, can you still call the number?
Yeah, absolutely. If you're under 40 and you're having signs and symptoms, we absolutely will get you in to be seen. It's hard if you're not under 40, if you're under 45 you have to have signs or symptoms in order to have a colonoscopy or a family history, because insurance companies won't pay for screening under 45. But we get around ways. But if you're having signs and symptoms, you should absolutely reach out if you're under 45. And I think I saw also if you're over 75, at that time, it's a conversation with the physician. If you have many years left in your life, if you're a young 75, then you should absolutely undergo colon cancer screening. If you have another 15 years left in your life, absolutely. If you only have maybe, if you're not as healthy 75, then that's when we'd say, okay, no more screening. But really, if after I have done colonoscopies on people in their late 80s, so who are still living alone and doing very well. So we literally after 75, we individualize it to the patient.
Okay, so to be clear, if you're under 45, call the number that was on the slide. If you're having symptoms, that is not the program that Lynn and Marjorie are running, but that is to schedule a colonoscopy.
Right, because what you're calling me for is a fit test.
Is for a test.
Right. What
And
you're
that's if
calling-
you're not having symptoms. If you're not having symptoms and you just want to be screened, you're calling Lynn to get a fit test. That's just
Okay.
screening. If you're having symptoms under age 45, that's different. That's a whole nother bag of worms where that's we need to work up we need to work you up for what's
Right.
going on.
Exactly.
Okay, can we just put these numbers in the chat again? So for a colonoscopy consultation, is that what you call it?
Yeah.
You call 202-839-1822.
Yep, and that's my direct line.
And that's Dr. Berkey's direct line.
Is it Marjorie?
It's Marjorie's direct line, but
Yeah.
she knows how to get a hold of us. Yeah.
Sure. Okay, and if you would like the screening kit,
Yes. This is Naomi Seeley.
go
Again,
ahead. Mhm.
I was wondering, I live out of town. I'm in New York, Brooklyn, New York. And I was wondering if I could receive the kit.
We try, the grant requires that we are sending those to people in the Washington metropolitan area. So I'm not certain, because if for some reason, if your kit comes back positive, then we need to be able to navigate you to the appropriate care.
Mhm.
So we are kind of limited to to distributing those in the Washington metropolitan area.
Okay, thank you.
Yeah, with that being said, Naomi, if you do have a primary care that you work with, they would be able to get you the kit as well.
Definitely.
I have a question.
Thank you.
Regarding if you have an alternative lifestyle or you do colonics or fast, how does that affect your colon health and the risk?
That's a good question. We don't have good data on it, but I just encourage people to eat a high fiber diet and drink a lot of water. It's one of the really good things, but there's not a lot of those two good things for your colon, but there's not a lot of data that discusses how cleanses affect the GI tract or the colon health particularly.
Okay, thanks.
Any other questions?
I have a question on colonoscopy prep. That you drank beforehand and so forth. And if it doesn't clean you out and you wanting to, try to eat properly, I hear you say a high fiber diet. Do you recommend a dietitian or nutritionist or someone that can say, because you're having that kind of problem, really what type of, foods you should be eating, the menu that you foods to eat and stay away from to assist with not being constipated regularly?
Yeah, it's always good you can meet with a dietitian to talk about high fiber foods. We also have a pamphlet that we hand out to patients that discuss all the different types of high fiber foods too.
Okay, and how can I acquire that particular pamphlet?
I think Marjorie, can we make that available for people?
Yeah, of course. We can mail them or hand them to Linnell, whatever's easiest.
So should Pat call the number for that, 202-877-5929?
Yeah, that would be
Yeah,
fine.
just leave your telephone number, and I'll call you back, Pat. Let
Okay,
me know what you need and we'll get it for you. We'll get it to you.
thank you.
You're so welcome.
Something else to note too is prior to getting scheduled for your colonoscopy, you'll come in for a consult appointment. And during that consult appointment, you can talk with the provider about your bowel habits. So if prep's been an issue in the past, say you've had a colonoscopy and the prep wasn't great, you would want to let the provider know that. And sometimes what they'll do is put you on like Miralax the week before. They'll add on a little more prep to ensure that you're cleared out. Some patients who have a long history of constipation will be on what we call a 2-day prep. So rather than doing the prep the day before, they're doing 2 days of clear liquids and taking 2 days of solutions to ensure they're fully cleaned out.
Thank you.
Any other questions?
I wonder if I can ask a question that might be very specific to myself, which makes me feel a little selfish, but because of my family history with colon cancer, I've had the genetic screening done recently, and I wondered if I've been found to have one of the mutations. And I wondered if you could just say a little bit about what those mutations mean, just generally about what that means in terms of screening and how it affects the body as well.
Sure. Certain genetic mutations increase patients' risks of colon cancer. And so if that is the case, then you have to have screening more frequently. Usually that is colonoscopies every few years, as opposed to the 5 to 10 years. It's usually every 2 years if you have a genetic predisposition, that a genetic mutation that is predisposes you. If you don't have a genetic mutation, but you have a strong family history, it's every 5 years that you get screened.
Thank you.
Thank you.
Definitely not a selfish question. I'm sure we all learned something there.
Yes, indeed.
Any other questions?
Nadia, before we sign off, Marjorie, I think we want to allow Jamia to introduce herself. She didn't get a chance to.
Oh, yeah. Yeah, forgive me. So Jamia Edwards is our new patient navigator, who Dr. Berkey had mentioned earlier on the presentation. Jamia is very new to our team. She recently joined us in the last 2 weeks. So Jamia, if you're still on, if you want to say hello and introduce yourself, that would be great. We're really excited to have her on board.
Thank you, Dr. Berkey and Marjorie. Hello, everyone. My name is Jamia Edwards. I come from the nonprofit background. I have been working with HIV and AIDS patients for the last 15, 16 years of my career. I have worked extensively with women who are pregnant, being their confidant, being their case manager, making sure they don't have no barriers. So me being able to be a part of the colorectal team, this is very interesting. And I'm excited to learn more about this. And I'm really excited to get to the point where I can do education piece and go back and educate my community, because I know my community doesn't know enough about screenings. And that's why a lot of us don't get them done. So I'm glad to be here.
Well, nice to meet you, Jamia. Welcome to the team.
Yes,
Thank you.
Thank you. There was one other question that came in, and this is a follow-up from the genetic testing. Is genetic testing specific to GI, and is it covered by insurance?
Testing is specific if you have family history, a lot of family history of colon cancer. They will look to see if you have, or any types of cancer, you're at a risk of developing cancer earlier or at a higher risk. And if you have a family history of colon cancer and a strong family history, the insurance company usually pays for it, but they won't pay for it if you don't have any family history of colon cancer.
Right. And in my instance, I had genetic testing because of the breast cancer, and I had a family history of breast and ovarian cancer. And the insurance paid for the genetic testing.
Good to know. Thank you. Is there any last questions?
Well, I'd just like to thank the MedStar team. I'd like to thank Dr. Berkey. Thank you so much. It's a pleasure to meet you the other day. And of course, Marjorie and Jamia, thank you all so much for taking the time out tonight to share with us. I appreciate it.
Yeah, of course. I'm so glad we could be here. I love talking about colon cancer and screening, and it is I lead the program, so it's one of my passions is to help get people screened.
Yeah,
You might not want to say that to me, Dr. Berkey.
I know, I probably shouldn't tell you that.
I'll have you working every night.
Yeah, we do. We do want to have more of these because this is a really important, I think, and a great way to reach people with this information. So
Definitely.
thank you very, very much. This program was recorded. So if you registered via the Brooklyn Village website, then I have your email address and I will send you the recording. And I will send you the phone numbers to either schedule a colonoscopy or participate in I'm forgetting the name, the neighbor.
Colorectal cancer, CCPN.
The colorectal cancer prevention in the neighborhood program, where you will get a kit sent to you in the mail and be supported in the process. Okay. Any last things about the program, Linnell?
No, I just thank you all so much. This is very, very important. And while this is March is Colorectal Cancer Awareness Month, every month is Colorectal Cancer Awareness Month. So we should be doing this every month. So we just don't want to, sitting before you in March. Call us in April. Call us in May. Call us in June. We want to get the message out.
Yeah. Well, thank you so much, everyone. Have a great evening and get screened.
Good night. Thank you all.
Thank you.
Good night,
very much.
everyone.
Thank
Good
you.
night. Thank you.
Night.
Good night.
Thank you. Good night.